Setting up and conducting an assessment using VedaPulse Professional device. To obtain objective and reproducible results, the assessment should be conducted in the morning, 1,5 to 2 hours after the last meal, in a quiet and calm environment. 24 hours of alcohol abstinence is required prior to the assessment, as well as absence of any physical and emotional stress during the previous days. During a 10-15 minute adaptation period, which is required before conducting the assessment, a client should be asked about health condition by monitoring his or current state. Such anamnesis normally calms clients down, thus creating conditions for proper assessment. The best position of a client during assessment is lying on a couch. A sitting position in a comfortable chair is also acceptable. During the assessment, a client should not speak, move, breathe deeply, cough or swallow saliva. After your client takes a comfortable position, place the electrodes on the wrists, with the metal plates located where the pulse is examined. To improve the signal, apply a special ECG gel to the metal electrode plates, or simply moisten their wrists with water. Do not use distilled water, it is a poor conductor. Better use regular tap water. The red electrode is placed on the right hand, and the black one, on the left hand. In electrocardiography, this arrangement of electrodes is usually called the first lead. After clicking on the new assessment icon, the monitoring parameters window will open. You will be asked to select the duration of the recording, automatically or manually. If you select the manual mode, the recording time is set manually. By default, the software suggests setting 5 minutes. And if the automatic mode is selected, the duration of the recording will be determined by the software during the recording process. In this case, the software will rely on the number of RR intervals and the client's heart rate. We recommend using the automatic mode for determining the recording duration, since at least 512 RR intervals are required to be recorded to receive correct results. After setting the duration of the recording, click on the Continue button to open the ECG signal registration window. Pay close attention to the ECG signal on the monitor screen for a while. Make sure that the signal quality is good. If the signal is weak, check if you applied enough gel or water. If the signal contains a lot of disturbance, then disconnect the laptop power cord and switch to battery power. Do not proceed to the next step until a good signal quality is achieved. If the signal remains weak and contains a lot of disturbance, use the second lead. The red electrode is placed on the wrist of the right hand, and the black one is on the ankle of the left leg. Working electrical appliances, poor electrical wiring, power cables proximity or a computer with a low noise control might cause electrostatic field to appear, leading to disturbance. Dry air, synthetic or woolen clothing worn either by a specialist or a client, creates an electrostatic field which can also become a source of interference. Normally, the second lead can increase the signal by 2 to 3 times. Combined with battery power supply, it allows conducting a high-quality assessment even with a very high level of interference. The software has 2 signal recognition modes, automatic and manual. The automatic mode is selected by default. Usually, a few seconds after the signal registration starts, the software automatically adjusts and begins to detect R waves. In this case, a heart-shaped icon will appear on each peak of the R wave. Keep track of this process for a few seconds. Make sure the R waves are recognized correctly. There should be no missing R waves, and heart icon should not appear on other waves, P or T. If there are no errors in the recognition of R waves within 10 to 15 seconds, then proceed to the recording by clicking on the Start Recording button. If it was not possible to achieve high-quality recognition of R waves in the automatic mode, then switch to the manual mode. The mode switch is in the upper right corner of the signal registration window. By switching to the manual mode, you need to adjust the threshold value. It is the topmost window in the settings, located on the right side of the screen. On the ECG graph along the ordinate, determine the amplitude of the R wave and roughly divide it by 2. Enter the resulting number in the threshold field. Watch how the software recognizes R waves. A heart icon should appear on each R wave. If the heart icon skips individual R waves, then you need to decrease the threshold value. If the heart icon appears on other waves, except for R, then the threshold value should be increased. The amplitude of the R wave is determined by individual electrophysiological parameters of a client. If the threshold value has to be lowered below 25 microvolt in order to achieve the R waves detection, then it is time to use the second lead, since this indicates a low signal level, and the risk of artifacts increases. But of course, the main reason for deciding whether to switch to the second lead is the fact whether it is possible or not to adjust the voltage threshold to achieve a stable recognition of our waves. If, in spite of all the efforts, artifacts appear, then you need to proceed to the second lead. Increasing the useful signal is often easier than dealing with the noise which can cause artifacts. The most important thing to remember is that there is no need to completely eliminate the noise, but it is crucial that this noise does not block the useful signal and does not interfere with the stable recognition of our waves. After adjusting the signal, click on the Start Recording button.